Buagada, Mrs. Temi Daly, Chief HR Officer at Sterling Bank, and Dr. Ola Brown, CEO Flying Doctors. So we kick off now. All right, Miss Antonia Oboko. She's helping us to moderate. She's the Business Day Health Editor. Miss Oboko, you are here.
Yeah, good morning, everyone.
Okay, Antonia, welcome. Nice to have you around. Okay, so our participants, welcome you all. I saw Mrs. Shobamo, you are there. You are welcome to this our session. So we I think we should, during the time the president of the chamber joins in, I think I should just hand over straight to Antonia. Antonia, hello? Antonia.
Hello. Yeah, I'm here.
Hello, you have a copy of the agenda with you? Do you have a copy of the agenda with you?
Yes, I do, sir.
Okay. So I think you should just take over. And as soon as the president of the chamber is in Ghana, as soon as he's able to link up, he will just run through his remarks. So let me hand over to you.
Okay. Good morning, everyone. Thanks for having me. My name is Antonia. The health correspondent Business Day, and I really thank you for giving me this privilege to moderate this event and the webinar between this Nigeria-American Chamber of Commerce. So today we actually have, can you hear me? Hello? Hello?
Yes, we can.
We can hear you, but speak up. Try and speak up a bit. Yes.
Okay. Okay. Can you hear me now? Am I loud enough?
Yes, you are audible now. It's better.
I'm audible now.
We can hear you.
Okay, so today we'll be having a laudable conversation, and that will actually move the Nigeria healthcare sector forward. And we'll be looking at the theme, sustainable healthcare management system and the value chain, reviewing the effective role of healthcare providers, financials, HMOs, and the HR management. So it's actually a very big opportunity for me to moderate this event, and I would like us to see how we can move the healthcare of Nigeria forward. So I'll indulge you to give me your time. At least I'll take a bit of your time, like 20 or 15 minutes, with some questions that would bring up solutions to shaping Nigeria healthcare sector. So I think I'm familiar with Dr. Brown. I'm also familiar with Dr. Ayo Shonibare. I'm meeting the Mrs. Temi for the first time. So I think it's an opportunity for me to see how we can have this great conversation that will better Nigeria healthcare sector. So I would like to start with Dr. Ayo Shonibare, the Chief Medical Director of Evercare Hospital. Dr. Shonibare, good morning.
Morning. Hi, how are you?
I'm fine, thank you. So, Evercare have been one of the biggest hospitals that have been established recently in Nigeria, and we know we have a lot of issues around telemedicine in Nigeria. And looking at the specialty of your facility, in what way do you think the industry should harness technology to accelerate healthcare delivery in the country?
Yeah, sure. Now, basically, with regards to technology is now critical for all industry sectors. Healthcare has been a little slow in application of technology globally. But of course, with the recent pandemic with COVID, It is now brought technology into the forefront. Basically, I think generally speaking, patients are now demanding use of technology because you're able to receive healthcare from the comfort of their homes at their own time, their own convenience. And with COVID, people are actually reluctant to visit hospitals physically. Now, with regards to ever care, we've always had technology at the back of our value stream. And so we're launching our service with telemedicine, which is already started. And then before we actually move on to opening the hospital itself very shortly. The thing about technology is if you look at patient requests, a lot of the things that people come down to hospitals for physically, they don't really need to appear physically. As a matter of fact, the future hospitals will focus on critical care, emergencies, and procedures. So that routine care like management of diabetes, high blood pressure, the common diseases that we know, even things like malaria, will take place virtually because they don't actually need to come to hospital. That is what is going to happen in the future. And that is the way healthcare is going. If you look at other industry sectors like aviation, banking, pretty much you can do all of this remotely from the comfort of your homes. It's just that healthcare is been very slow to adopt this change, but patients are now more or less putting pressure on healthcare providers to move this ahead. As you're aware of, there are numerous telehealth platforms in Nigeria today. They're all gaining traction. And if you also look at it, basically with healthcare, you look at three things. You look at affordability, you look at quality, and access. So if you look at access, how do you get access to, let's say, Nigeria, well, Lagos, 20 million people? The only way you're going to do that is through technology. In terms of affordability, certainly you don't, if you look at the technology telehealth platforms today, the rates for consultation vary between, some of them even offer free consultation, but it varies between 500 Naira to 10,000 Naira, 15,000 Naira. So, and compared to physical consults, which will vary between anywhere between 510 to 20, 30, and in some cases 50,000. So you're already getting some, in terms of, you're already getting discounts in terms of pricing for consultation. Obviously, if you then need to move on to treatment, then you can do a lot of treatment even by technology. Pharmacy companies can deliver medication. Laboratory can actually come to your homes for blood tests. So really, I think, like I said, it's been slow in adoption, but the present pandemic is actually brought it at the forefront. And that is where healthcare is going to settle. That is where patients are demanding for it. And I see that it's the way to go. So as a healthcare delivery system, this is something that needs to be incorporated. I mean, you can do a lot with technology. There's telepathology, there's teledermatology. If you have a skin rash, why do you have to get into your car to go to a hospital just to show a dermatologist when you can actually take a picture and you can show the dermatologist, gives you the diagnosis, and the treatment can be done. So that's just one simple example. And even within hospital systems, technology is value enhancer. You can have second opinions, you can consult with colleagues, you can have training all done by technology, you can have virtual reality, augmented reality, you can do a lot using technology. So I don't think any healthcare of the future is going to survive if they don't adopt technology.
All right, thank you very much, Dr. Ayo. So I would like to also speak with Dr. and Mrs. Teni Bailey. So following with the team we're having today, Sustainable Healthcare Management, and as an HR personnel, I know you have a whole lot you can contribute into the Nigerian healthcare sector in terms of management, and with your specialty, we want to see how we can bring solutions into Nigerian healthcare. But most of my questions are solution-driven questions, so that we can get a way forward for our healthcare sector. Good morning, Mrs. Teni. Okay, so our healthcare allocation in Nigeria and the state budget are actually far below expectation, making it difficult to achieve human capital development in the country. So what do you think can be done for us to get, what do you think must be done if truly we want economic prosperity through human capital development in Nigeria? Hello?
Okay, thank you very much. Can you hear me? Because I lost you for. Can you hear me?
Yes, I can.
Okay, so thank you very much. I think I'll speak on 3 core areas. I think that, firstly, like we're all aware of the issues we have around healthcare and health delivery in Nigeria. I think that from a government perspective, it's still something that needs to be addressed in terms of funding. When you look at the budget and you look at the amount that is assigned, you look at data, you look at the data that is out there. When you look at the predictions of the WHO, it's saying that life expectancy is between 54 and 55. You look at mortality rates, you look at infant mortality, you look at even child complications.
Hello?
Hello, Antonia.
Hello, sir.
Antonia.
Hello, sir.
Yes, can we pause a moment? The chamber president has been able to log in from Ghana. He just wants to say a few words. Is he allowed to do that? Can he do that now?
Okay, but Mrs. Temi is actually offline now. I think she got disconnected.
Well, when is the time he gets back? She gets back. Let's just quickly take the chamber president so that he says a few words. Mr. President, good morning, sir.
Good morning, ladies and gentlemen, and I do apologize for holding you up. I even employed the IT consultant for the Kempinski Hotel, so don't blame me that I'm not compliant. I even got the IT, everything messed up this morning. But however, I'll just give a short address. We are very happy, all protocols observed. We are very happy to record today our 5th webinar after the COVID-19 lockdown. The Chamber is determined to sustain these value-driven programs for the benefit of our esteemed members, and we thank you all immensely for taking your time out of your respective very busy schedules to join us today. The potentials of the healthcare value chain sector towards the national development cannot be overemphasized in a developing company like our own Nigeria, with the huge population of over 200 million people and a viral workforce in excess of 120 million. or about 60% of the total population. Therefore, in putting this webinar together, cognizance has been taken of all possible stakeholders, including healthcare providers, hospitals, healthcare professionals, HMOs, and HR managers, etc. We have two other webinars later this month. The Access to Finance webinar takes place on 24th November in conjunction with Standard Chartered Bank, while a credit union initiative to provide banking solutions to the teeming number of Nigerians in the diaspora, starting with those in the United States, takes place on the 27th November 2020. The Secretariat will screen these upcoming events and schedule dates for the rest of the year during this meeting. Also, for sponsorships opportunities of Chambers' various events, kindly contact the Secretariat. Mr. Obadimo Awebu DG will be on hand to assist you, please. Without wasting further time, we welcome our esteemed panelists on today's webinar. We thank you immensely, Evercare Hospitals, Lekki, for sponsoring this edition. We also thank our distinguished members and everyone virtually here with us for kindly sparing from their very busy schedule the time to be with us today. Ladies and gentlemen, I wish all of us an enlightening and fruitful deliberation and interaction. Thank you. Thank you all.
Thank you very much, Mr. President. Those are our president's words for us today. And as he has said, as we go on towards the end, we'll screen the list of remaining events for the year. Antonia?
Thank you for having me. Yeah, I'm here, sir.
All right, you can proceed.
Thank you. All right, sir. Mrs. Temi, sorry for keeping you.
Yeah.
Thank you very much for your
No
time.
problem. I'm not sure where you heard me last, because I think I got disconnected for a couple of minutes. Yeah. But I was starting from the government perspective to say that there's a lot more that the government can do for us in terms of budgeting and funding. And then I will move quickly to the private sector. And I will speak firstly, before I speak as a human resource person, I'll speak from the business perspective from Sterling. And when Dr. Ayo was speaking to us, he kept emphasizing on technology. And I believe that he's absolutely right. You cannot make any advancement in the healthcare sector without leveraging on technology. One of the things that we have done is that we partnered with a company that offers telemedicine called Mendol, and we utilized it during the pandemic. It was open to our customers and our employees, and we offered it free of charge for a couple of months. And these gave easy access, especially to people in the rural areas, which means that they have ability to have access to quality care, to quality doctors remotely. And a lot of the ailments that you have can actually be dealt with leveraging on technology. So for us at Sterling, being that health is one of the sectors that we're focused on, it is a big space that we want to play in leveraging technology. One of the things that we're also thinking about is you keep thinking about the people in the rural areas. How do you get medicines to them? How do you offer emergency services? And so we're always looking at partnerships in the ecosystem. How do you begin to utilize the drone services so that people can get easy access and you are able to, this would have effectiveness on cost and even your processes. And I think that these are some of the things that we can do from a business perspective, and we need a lot of private sector organizations to get involved. From an HR perspective, I think that we can't do enough in the workplace. One of our primary objectives in the workplace is to ensure that we provide an environment that is healthy and that it is safe. You also want to ensure that the health of your people at top priority becomes a core organizational value. And this is where I think that our HMOs can really help us. They can really partner with us and work closely with us. I have worked in the financial sector for a number of years, and I've always worked with a number of the HMO services. But I find that a lot of the offerings is focused on the physical health care. And we forget about the total well-being. We forget about the mental issues. We forget about the emotional well-being. Luckily, with the pandemic, some of these things are becoming highlighted. Way back in 2018, I had to partner with a clinic to set up what we call our employee assistance program. And what does this do? This gives our employees access to the full bouquet of healthcare, both mental, both emotional. You have 24 hours access to psychologists, because even the data has shown us that even in Nigeria here, 1 out of every 4 has one mental disorder or the other. And one of the greatest issue that we deal with is depression, because of all of the challenges that we have around us. Another thing that we have done, which I would also implore our HMOs to consider, is elderly care. So your standard basic package is always the spouse and the children. During the lockdown, we were able to introduce the elderly care package, partnering with one of the medical outfits to our employees, and it was well received, because the truth of the matter is the pandemic affects the older generation more than the younger generation. So I'm able to take care of my aged parents, my aged guardians, and ensure that they have that good quality care. I think these are some of the areas, as we discussed, that we really need to sort of be able to make positive influences in ensuring that we move our healthcare forward. And it's beneficial to all parties involved. Thank you.
Thank you very much, Mrs. Temi. Thank you so much. You made some important points in terms of moving the healthcare forward, in terms of adding the old people into looking at their healthcare. So I really see what you contribute as an insight for us to really look at how we can broaden healthcare, especially in terms of human resources capital, and how we could also manage all with technology. Thank you very much for your contribution. So actually what I'm doing is I'm picking each panelist one at a time. So I would like to speak with Dr. Ola Brown this time around. Dr. Ola, are you there?
I'm here.
Good morning.
Good morning.
Good morning, yeah. So basically we move to investment this time around. So that's what we are aiming to discuss with you. So based in Nigeria, Flying Doctors Healthcare Investment Company has already had a number of healthcare technology companies, and its portfolio are worth about $200 million. So our understanding is actually shifting from what we used to have before in terms of healthcare technology and investment in Nigeria. So now in terms of future, the most important thing we need to learn now about is healthcare investment, and which is your passion and which is what you always talk about, healthcare investment. So how long is it going to take Nigeria to set up a standard of healthcare in terms of betterment and investment? How long do you think it's going to take Nigeria to have such standard? And what can be done, and what are the way forward for Nigeria to get a better healthcare investment?
Okay, so I'm going to speak about 3 issues. I'm going to speak about the economy and the sort of the wider Nigerian economy. I'm going to speak about healthcare specifically, and then I'm going to make some comments around healthcare investment and technology. But first, I'm going to sort of start our discussion with asking a few questions and sort of talking about some things that we say, but I believe that we don't really think about. So for instance, one of the most common comments that I hear, like even from the most intelligent people in Nigerian society, is, all these politicians going abroad, why can't they build the exact type of hospital that they go to in London here? Why are they going abroad? They are very greedy. And that's really, really a common sentiment, that they should just build it in Nigeria. So I'd be interested to know from the audience who really agrees with this, because I'm on the fence about it, to be honest, and I'll explain why as I go on. How many people, if we could just have a show of hands, really feel that we should have exactly the same kind of hospital that they have in America, in Nigeria, and we should just build it here? I can't see any hands in the chat box, so I guess nobody thinks that. Because, you know, the children's hospital that has just been completed in Dublin is going to about $3 billion of spend on one hospital, only for children and not for adults. And if you look at Nigeria's national accounts, because I'm a doctor and an economist, so I look at the budget and I look at the healthcare side of things. I'm not sure that Nigeria even made in total up to $3 billion in oil revenues this year. I'm not sure. I'm not sure that the government take from oil was what they used to build a high-end children's hospital. So for us to say that we want exactly the same thing, we need exactly the same revenues. And if you look at Nigeria's macroeconomic picture, you can see that one of our biggest problems in Nigeria is revenue. We simply do not generate enough to do anything for the sort of population we have. So the only thing that we really, I mean, your revenue comes from what you can export, what you can make. So if you look at a state like California, California generates about the GDP of California is about $3.4 trillion. That's almost, would I say almost 10 times Nigeria, just a state with 35 million people. But what do those 35 million people do that Nigerians don't? They make movies. Hollywood, right, is a big generator of revenue for them. They have tech companies, Uber, Facebook, Twitter, the biggest companies in the world, Google, Amazon, they're all there generating revenue and generating revenue for them. They're the biggest wine producers in the world. So they have that going for them as well. So they're able to generate so much more revenue, just the 35 million of them, than all of Africa. So when we're considering what we want to build and the healthcare infrastructure that we want to build, I think the most important the most important sort of question is not what we'd like to have, but what we can afford. Because even if we build that hospital,
Hello? Hello? I think we lost her.
that is $3 billion. Manpower, the salaries, the operational costs, how do we take care of those kind of expenses as well? What money would we use to run it? And do we want to spend all of our revenue on just one thing, healthcare? So, and who does it benefit when we build hospitals like that? We already know that if you want good healthcare in Nigeria, gold standard ICU, you can get it, but it's 1.5 million a night. And that's not because the hospitals are being greedy. It's because that's very, very close to the price. It's not as if these hospitals are as profitable even as FMCG companies, they're not. So it's because the price of healthcare is pretty expensive, and the price of healthcare is expensive all around the world. It's not just Nigeria. The price of healthcare is expensive in the US, they're struggling with it. And it's something that every election, you hear healthcare coming up, right? They want to vote for Bernie Sanders. Why? Because it's going to make healthcare free. They want to vote for Boris Johnson. Why? Because it's going to add money to the NHS. It's not solely a Nigerian problem. The Nigerian problem is revenue. Because the British budget for healthcare for just 60 million people is $250 billion. The budget federal only for Nigeria is $1 billion. That means that if one day, tomorrow, for instance, Boris Johnson came and said, you know, I like you Nigerians, I'm going to give you my entire budget for a year, it would take Nigeria's healthcare budget for almost 300 years. That's just their healthcare budget. So now we get from the economic perspective to the local perspective. And going back to the question that we asked earlier, do we really need those type of mega hospitals in Nigeria? What are the politicians really flying out for? They're flying out for complex heart procedures. They're flying out for complex orthopedic procedures. They're flying out for, you know, very, very super expensive, super specialized procedures. Is that the problem of the average Nigerian population? Or is it stuff like clean water? Is it stuff like malaria? Is it stuff like pneumonia? Is it stuff like safe conditions for giving birth? We want to do healthcare interventions that will benefit most people in the country. And over half of our population earns less than 30,000 naira per year. So most of our population in Nigeria live in extreme poverty. No matter how many high-end hospitals we build, they're not going to be able to afford it. But are there things that we can do, ways that we can spend our money that will benefit those people, those 100 million people living in extreme poverty at the bottom of our pyramid? So those are just questions. I haven't given any answers yet because I think that, you know, the point of a panel discussion is to, you know, ask questions and try and give statistics and give data, both economic data on the macroeconomic side and on the microeconomic side in terms of, you know, what the households actually earn in Nigeria. And then try and figure out a way where there's a consensus about moving forward with our healthcare system. So is it really high-end healthcare that we need, or do we need more primary healthcare investment? Do we need more sort of malaria drugs, more pneumonia drugs? Do we need more, you know, primary healthcare centers where people can get the basics? So I've asked a lot of questions. I haven't given any answers, but I hope that it stimulated everybody to start thinking about the reality of our situation, our economic situation, in terms of the fact that, you know, we talk about a percentage of our budget, a percentage of our GDP. How much GDP do we spend as a percentage on healthcare? But increasing it takes money away from a lot of other stuff. And like I said, we're already spending 70% of our budget on debt servicing. By next year, we're taking another loan now. We'll probably be spending 80% of our budget on debt servicing. So Nigeria is already like that guy. I always, when I'm trying to explain the economics of Nigeria to people, and I don't want to offend any of our men in the room, but I always say it's like, you know, what would you do if you're a woman and you're dating a guy that earns 100,000 naira? And, you know, he spends 80,000 naira of his salary every single year, just every single month, just paying back people that he owes. With 20,000 naira, he needs to cover rent, he needs to cover your kids' school fees, he needs to cover clothing, he needs to cover food. No, but he only has so little space left to do all of that stuff, and he has to prioritize. And I think also Nigeria is in that state where we have extremely low revenues. Most of our revenues are spent on debt, and we need to prioritize what's important for most of the population.
Hello. Hello. Okay. Thank you, Dr. Ola. I think she locked out. I don't know if she's done.
To do all of that stuff, and he has to prioritize. And I think also Nigeria is in that state where we have extremely low revenues. Most of our revenues are spent on debt, and we need to prioritize what's important. Hello?
Hello, I can hear you.
I'm going to switch my video off because I don't think my internet is that good, but I can hear you and I can see you.
Okay. So, are you done? Hello?
Yeah, that was my last comment.
Thank you so much for your contribution. There's a whole lot of noise in the background. Hello?
Hello, I can hear you.
Hello, I can hear you.
I'm going to switch my video off because I don't think my internet is that good, but I can hear you and I can see you.
All right, that's fine. Thank you very much for your contribution. You made several points on Nigerian GDP and why we should also look at getting this huge investment into healthcare in terms of building up our facilities and why we should create more avenues. Just like you said, you have questions. Why can't we have these facilities in our country? Why can't our primary care center get better? So these are question-based and still need solution. And looking at stakeholders in the sector, we know with partnership and collaboration, with your insights and your contributions, these certain issues are being looked at and see how the country can actually push forward in terms of creating more avenues for this investment to come into the country. Thank you very much, Dr. Ola, for your contribution. So we'll actually move to our next panelist, Professor Mohamed Nessa Sambo, the Executive Secretary and the CEO of National Health Insurance. So being represented by Dr. Yakub Agada, excuse me, being represented by Dr. Yakubu Agada, the HMO and the NICEP. Hello, can you hear me? Hello.
Yes, moderator.
We actually nobody colliding with the conversation.
Hello.
Hello.
If there's a way you can work on the background noise a little so we can hear you clearly, and then that would
Hello.
be nice.
Can you hear me
Good
now?
morning, everyone. Can you hear me?
Hello, I can hear you.
Okay,
Hello?
I was talking about the possibility of reducing the background noise a little so we can hear clearly.
Okay, so can you hear me now?
Thanks for inviting the Executive Secretary of NHIS. Is unavoidably absent this morning, not the usual unavoidably absent, but because he has he's had to move out of town to do one or two things. I cherish this opportunity to speak here to this webinar of Nigerian-American Chamber of Commerce. And in my contribution, I'd like to start by looking at the whole system. Health system. Is always good to do the system thinking way of looking at things. So if you look at the WHO's building blocks, you look at service delivery, you look at health workforce, information, medical product, vaccine and technology, financing, and then leadership. So all these, as we discuss sustainable healthcare, we must look at all of them. They are very critical to what we can achieve. And so for healthcare financing, which is what my NHIS is about, I work, by the way, my name is Dr. Yakubu Agada Amade. I work for National Health Insurance Scheme, and I'm the acting general manager in charge of standards and quality assurance. So for healthcare financing, we have three key determinants for health system performance, and the three principal healthcare financing functions are resource mobilization, which we try to do at NHIS, pooling of funds, which is one of the key objectives of every health insurance system, and then allocation of those funds, especially allocating them efficiently. So in talking about sustainable financing, we must consider the sustainability of the various opportunities open to us. We must look at effectiveness of the services we render, and then we must look at efficiency. So one is money for health. Can we get more money for health? And this is not inelastic. We must look inward. What do we have available in the country that we can mobilize to bring that? So can we mobilize more domestic resources, things like health tax, health funds, and all that, to channel it to sustainable financing? And then do we have adequate domestic allocation? We have the 15% Abuja Declaration I think we're doing just about 3-point-something% now, not up to 4%. We must work on this. Both state and federal government must do the adequate domestic allocation. We must engage the ministries of finance and budget. They don't understand your head language. So when we hold functions like this, we're supposed to bring them here to see what the problems are so that when they see the head budget, they will understand your language. Then more health for money. For the little money we have, and I think the panelists that just finished speaking had captured this vividly. How do we use the money that we have more efficiently? How do we improve efficiency? How can we use even the little resources? Do we build the biggest hospitals, or do we look at what the people need and begin to prioritize? And then how do we improve public financial management? Then for innovative financing, which is key for a resource poor environment or constrained environment like us, we must look at how do you exploit joint funding options to leverage on external funding. How do we increase the use of innovative funding approaches? I've seen a lot of things. I think this year's appropriation have something called the Cancer Health Fund. And this is the way of bringing fund into the health system to begin to finance some of the more high cost interventions. Then the fourth one is facilitating consensus building like we are doing here and knowledge sharing today. Evidence-based decision-making, consensus, knowledge sharing. We need to improve on this. We need to do this even more. The Nigerian-American Chamber of Commerce is already doing that. We need to come together to share ideas. And then at the end of it all, bring up policies based on our discussions and what we have agreed. So for sustainable health financing, there are some very critical success factors. There's a stakeholder engagement, collaboration, and coordination. There is development and implementation of innovative context-specific strategies to improve financing for the health system. These are key investment of adequate resources in the health system. I've mentioned that there are policies based on our discussions and what we have agreed. So for sustainable health financing, there are some very critical success factors. There's a stakeholder engagement, collaboration, and coordination. There is development and implementation of innovative context-specific strategies to improve financing for the health system. These are key investment of adequate. Can somebody hear me? I've mentioned I don't know, there seems to be recorded and then it's playing back. Health financing, there are some very critical success factors. There's a stakeholder engagement, collaboration, and coordination. There is development and implementation of innovative context-specific strategies to improve financing. I think there's a problem. There's a feedback. And then somebody hear me. Can you stop that recording? I don't know. There seems to be. Hello.
Hello. There's this repetition
some technical issues. Yeah.
Issues. Yeah.
So. Hello? In conclusion, efficient and equitable utilization of resources, like I said, monitoring and evaluation for accountability, transparency, and future planning. Then what are the roles of private sector? How can private sector come in to advance us towards a sustainable financing? So we'll be looking at advocacy for improved funding to the health sector. We can look at investment in infrastructure, resource mobilization to support the demand side financing. So we can have all the beautiful hospitals. We can have the high-tech hospitals and all that. But if the people can't pay to access it, then we haven't really done anything. So we must look at the demand side financing to be able to get people to access these provisions that we have made. And then capacity building in health financing is also key, so people can begin to understand, especially for people in Ministry of Finance, in budgeting and all that, so they can see the essence of putting money in health. And then we must get support for strengthening public systems, especially in the areas of quality control and accountability mechanisms. And we must collaborate to improve technology and reduce costs of drugs and services. So these are some of the ideas that we have at NHIs we are working on and seeing how we can improve and take healthcare financing in Nigeria towards a more sustainable health system. Thank you very much.
Thank you very much, Dr. Yakubu. It's a great investment, and it's a great. I see that a lot of things are happening in the Nigerian health insurance scheme, and we hope these plans are being established to better our health insurance in Nigeria. Thank you very much for your contribution. So I will we'll quickly have Dr. Kukoyi, the medical director of AC Medicare Clinics. Hello. Hello.
Hello.
Hello.
Can you hear me?
Okay. Good morning, sir. Yes, I can hear you. Welcome, sir.
Thank you.
All right, sir. Quickly, sir. Considering the population of health in Nigeria, the country now faces double whammy scenarios with increasing prevalence of non-communicable diseases, compounding the existing burden of communicable diseases. In your experience, what are some of these areas of clinical operations that are lacking in terms of improving patients' health in Nigeria?
Well, thank you very much, Antonia, and thank the Chamber for inviting me to be part of this very necessary conversation. Well, as regards your question, there's no doubt that we now have an increase, not just in non-communicable, but also communicable diseases. We just had the COVID-19, for instance, but luckily the effect was not as lethal as we have in other countries. As for the non-communicable diseases, which, as you rightly noted, is becoming so common, things like diabetes, for instance, and hypertension, stress. I would say these are things that are increasing in the population, and we really need to do something to make sure that these are taken care of effectively. I must say that the private sector, I mean the private health providers, are in a very good position to do this, because we all know that as statistics have revealed, we cater for almost 60% of the population. But I must also stress that the private providers are in sort of problems in rendering their services. For instance, we know that not many people can afford private healthcare. Out of pocket is so high in Nigeria, but then we cannot really cope with all this. At best, I think what NHS has done for Nigeria, they have tried a lot, but I think with the coverage of about less than 10%, they still have a lot to do to improve on universal health care. I'm sure that once this is done, it will be more affordable for patients to access health care. And this has been a burden, and maybe I should just quickly talk about the private providers and NHI's relationship. There's been a sort of unfriendly relationship between the two, I mean the HMOs and the private providers. And I think we should just strengthen this relationship if we have the interest of the patient at hand. I think NHS will also do a review of the pricing of the healthcare in Nigeria. If we are still going by what they used to have, 500 naira per month now, upgraded to 750 per month per enrollee. I think it's just inadequate in the economy that we are operating now to ensure quality of care. Then I think the onus is also on the healthcare providers themselves to improve on the quality of care. And in this wise, I think technology is also very important in making sure that not just improve the quality of care, but improve the efficiency with which it is delivered. And I think things like we talked about telemedicine earlier, teleconsultation, for instance, will reduce both the time spent in accessing care and also in the costs in the long run. I think by the time we marry all these things together, it will ease the burden on private providers and in that way increase the quality that they are delivering to patients right now. So may I also talk briefly on the financing of healthcare in Nigeria, because this also impacts on the quality of care. Government is not really encouraging private providers as it should. The only time when I think the government came to the aid of private providers is during the COVID era with the CBN Intervention Fund. But I must also say that from the feedback that I have, not many private providers have benefited from that gesture. So I will advise that government should step further by creating a special fund for healthcare in Nigeria and make facilities available for private providers at very reasonable rates. By doing this, it's going to encourage both the quality of care and the interest of medical doctors in providing healthcare in Nigeria. And of course, we all know that it will also decrease the mass exodus of doctors in Nigeria to other countries. Thank you very much.
Thank you very much, Dr. Kukoyi. Thank you so much. You made important points in terms of government increasing, getting special funds for the healthcare. You talked about the quality of care and how we could strengthen relationship between private sectors and the HMO and the NHIS at large in order to see how we can better Nigerian healthcare system. Thank you very much, Dr. Kukoyi. Thank you for your time. So I still have my panelists around, and I could see Dr. Ayo is still very much available. So I will still have a one-round question for all my panelists, but this time around, I think I'll just take like a few seconds for you to just give me a roundup in your contributions. So Dr. Ayo, we know we have a lot of things that have happened this year in the country and in the world at large. So we're looking at the effect of COVID-19 affecting the Nigerian healthcare sector. So I would like you to just give me your own opinion on how this impact of COVID-19 has affected the healthcare providers and their finances, especially in terms of the 70% out of pocket being paid to healthcare in Nigeria. So I would like you to tell me how this has actually impacted the healthcare providers and their finances. Hello, Dr. Ayo.
Yeah, sure. Yeah, basically, and in fact, in terms of COVID impact, I mean, it has been negative because patients are actually reluctant to come to hospitals, but which means that that's where technology comes into play in terms of telemedicine. The sad case is also a lot of the hospitals all over the world, including Nigeria, they're actually not built for COVID management. Because ideally, if you're going to manage COVID patients, they should be completely segregated from the rest of the patients in the hospital. So people need to begin to retrofit and begin to think through. For instance, at Evercare, we already have a COVID preparedness plan and how we segregate COVID from non-COVID and be able to manage appropriately to give patients confidence. Nigerian patients also have this phobia that they cannot be treated in a COVID, quote unquote, COVID hospital. So there's need for education. And the point I would like to make, though, is that anyone looking at healthcare as business in the light of COVID need to think through certain things, because the hospitals of today really need to focus on emergencies, critical care, procedures. So people need to begin to think through how they're going to restructure their hospitals in terms of revenue, because people will get most of the care they need moving forward. They will get that by telemedicine. So it's a complete change and focus on the areas that people need to, in terms of revenue generation. Nigeria is a large population. We have a double whammy where we have increasing communicable diseases and non-communicable diseases. The increasing communicable diseases because of poor public health, poor sanitation, poor housing, poor transportation, poor malaria control. So, but again, we also have the impact of non-communicable diseases because of high prevalence of hypertension, diabetes, cancers. So we need to look at both. Government will need to focus mainly on primary health care and improving the public health so that people don't, so that we can significantly reduce communicable diseases. And then we need advancement and the more complex hospital to be able to focus on the non-communicable diseases. And this will need to be done at scale. The reason why you can't run all these hospitals profitably is because people are building papa mom shops. People are building 10-bed hospitals. You can't build a 10-bed hospital and want to make that profitable. You need to do it at scale. That is why we've done a 165-bed hospital. If you do that, you can reduce your pricing, you can sweat all your assets, you can bring the volume in, and you can still generate profit. I think that's something that, and we also need to begin to look at groups. I think if you're talking health insurance, for instance, people need to how do you take a large group, let's say like your market women, and provide insurance for those groups at the prices that they can afford? So I think we need to design healthcare for the target audience, and you can make it affordable and at the same time still provide high quality with very good outcomes. I think that's the way. It requires a lot of innovation, but it can be done. It's not rocket science. It has been done in several markets. So thank you.
Yeah. Thank you very much, Dr. Ayo. Okay, so we don't really have much time, so I would like to still ask Mrs. Temi one question before I move to the other panelists. Mrs. Temi. Hello? Hello?
Yes, I'm here. Can you hear me? Hello,
yes,
can you
I
hear
can.
me, Anton?
Yeah.
Can you?
Yes, I can hear you, ma'am. Okay, thank you. So
Yes,
I just have one more question for you. So healthcare industry is one of the most talented acquisition industries that has to do with life and death. And it's also one of the industries which staffing deficiency can literally mean life and death. So the healthcare industry has always hardest operation under certain amount of pressure in terms of shortage of staffing in Nigeria. So since their work is critically to the health and well-being of many Nigerians, professional dealings with incredible levels of pressure and the recent trend indicating that the pressure is actually much and it's actually increasing. What is the role of human resources in developing staffing and in terms of improving management of human capital and development in terms of staffing in Nigeria? How do you think this can actually be improved as an HR?
Okay, thank you, Ms. Well, I think that we can't overemphasize and we can't overflog capacity building. And I think that we have to continue to invest in building the capabilities that are needed. Yes, the health sector is critical. And I think that even in recent times across the globe, because of the pandemic, we all begin to realize how critical that sector is and how important it is to have the qualified personnel that are required and ensuring that there are refresher trainings. I recall that during the heat of COVID, Lagos State kept doing a lot of refresher trainings for a lot of their medical personnel that handled a number of procedures, a number of testing, that worked at the isolation center, and we could see the impact of those things. But for me, I think that I would like to address it from a global perspective. And what do I mean? And I'll still go back to my point, which aligns with what Dr. Ayo said at the beginning, is that we must leverage on technology. Dr. Ola, she asked a couple of thought-provoking questions. If we continue to rely on the human beings and the numbers, do we have enough of them on the shores of Nigeria? We are aware of how much, especially doctors. I learned that we have up to 800 or 900 doctors that are shipped out of this country every month, going to work in the Western countries. And so we must be in tune with reality and ensure that we leverage on technology. For example, the telemedicine that we spoke about, I have utilized that. And it gives you access to doctors across the globe. And so you're not limited to just the physical doctors that are in Nigeria. I'm not saying that you want to have it side by side. I like the fact that a lot of hospitals, a lot of medical organizations have started to think and come up with innovative ideas of how we need to deal with some of the issues that we have here in Nigeria. There was something that we set up at work for our pregnant women. I talked about the rate of the death rates at childbirth, child complications. And at a point, we felt that we needed to have a dedicated resource that could work with our pregnant employees to ensure an increased success rate of delivery of and safe. And we partnered with an organization that is based in the UK. They had midwives locally, and it wasn't expensive. And the education, the awareness that was created, and a lot of times they leveraged on technology. And so we must, as we look at the future, yes, we have to continue to train the human beings, but we must also leverage on technology. I also want to speak about access. We need to think about access for especially the rural areas. And that is where technology comes to play. So where we can't even get the qualified doctors to, if there are platforms that they can remotely get access to the care that they need, then we're that at least we're making some advancement positively. Thank you.
Thank you very much, Mrs. Temi. So I think we'll just take a minute to wrap from each person from now. So I would like to, okay, Dr. Ola Brown. Hello.
Hi. So I think I can get what I want to say in a minute. The first thing I'd like to say that there's absolutely no country in the world that has achieved universal healthcare without significant government investment. So it might sound a bit abstract when I'm talking about the budget and when I'm talking about the macroeconomic makeup of Nigeria, but we know from the evidence around the world, there isn't a single country in the entire world that has made progress with universal healthcare without significant government investment. So there needs to be government investment. And that's why I believe that as much as we think that our problems in medicine are clinical, it's a lack of doctors, it's a brain drain, it's a medical tourism, it's a, I think that those are not the root causes. I think the root cause of bad healthcare in Nigeria is actually economic. Healthcare is expensive. It has to be highly subsidized by government, and the government doesn't have the money. I think that like there's a generation, maybe my parents' generation, that were born like I think in the 70s, and there was actually money in Nigeria because Nigeria was half of the population it is now. Now we have a country that the population is growing at 4%, but the country itself, in terms of our economy, is growing at minus something percent. There are only 8 countries in the world that have gotten poorer on a per capita basis for the past 20 years, and Nigeria is one of them. So I think there's a lot of solutions that we can do, a lot of innovations that we can do around technology, around financing, around taxation, around levies, around focusing more on primary care than tertiary care that we can do to improve the situation. But the only way to really, really move the needle is to increase our revenues. Because Nigeria doesn't make enough money to do anything. It doesn't make enough money to fund education. It doesn't make enough money to fund infrastructure. It doesn't make enough money to fund roads. It doesn't make enough money to fund anything that a country is really supposed to fund. So the root cause of our problems are low revenues. And I think that that's something that, the government really, really needs to concentrate on, how to improve tax revenues, how to improve our structural policy and ease of doing business so that we can get more revenues into the country. So if I was to say a summary, I think, yes, there are, clinical issues around, the skill of our doctors and, the economies of scale issues. But I think our real issues are at least partly economic, and that's the root cause of sort of any investment that will really move the needle. Thank you.
Thank you very much, Dr. Ola Brown. Okay, so we'll quickly move to Dr. Yakub. Hello? Is Dr. Yakub there? Hello?
Yeah, so thank you very much. Yeah, I think what I would have loved to say have been captured. We have a big economic problem here. And except the economy is going to improve, we must be innovative. We must mobilize funds to be able to fund the health that we all care about. During the discussion, some few comments were made. I'd just like to provide a kind of clarification quickly. A review of drug price lists and service lists is on. We have some challenges around costing the benefit package and all that. That's ongoing. Probably very soon we'll have a new list. And then the relationship between HMO and healthcare facilities, I think that was just hitting the nail in the right place. And you see, we are aware, we are working on it to improve that relationship. And until that relationship is cordial, it's going to be difficult to provide the kind of services we want to provide for our enrollees. Finally, somebody spoke about providing healthcare, health insurance for groups. And if you watch the news, in the next few days, we are going to launch what we call the group, individual, and family social health insurance. And that will provide health insurance for an individual who wants to register, for group, and for all that. And we are going to roll that out immediately. I think the launch is on the 26th, next week, just exactly 1 week from today. And we'll be rolling that out, and people can come in group, and families and individuals can register on National Health Insurance. Thank you very much for having us here.
Thank you very much, Dr. Yakubu. Okay, so quickly we'll call on Dr. Kukoyi.
Well, thank you once again. My worry and concern is not just for now. It's really about the future of healthcare in Nigeria. For Nigeria to have a sustainable healthcare, a lot of things really have to be put in place. For instance, our population is about 200 million now, and it is estimated that by the year 2050, we're going to have a population almost double of that, 400.5 million. And what are the things that we have put in place to make sure that at that time we still have a good health? Well, universal healthcare is one of the basic things that we must aim at, and that is why I put a challenge to the national health insurance. The political will must also be strengthened. But beyond all that, I think information technology is the way to the future, and I think we should just grab every opportunity to make sure that Nigeria gets on that train and we improve on it very vigorously. The US population in 2050 is going to be less than Nigeria's population at that time. So what are we going to do? The race must start from now. Thank you very much for the opportunity to be part of this wonderful session.
Thank you very much, Dr. Okokori. It's actually a wonderful section, and I really appreciate your time. I thank the Nigerian-American Chamber of Commerce for giving me this privilege to moderate this webinar. And with our contributions today, I see a whole lot of outpouring innovations. I see a whole lot of passion in terms of coming up with collaboration, in terms of coming up with plans to see how the Nigerian health sector can move forward. And I think with these contributions and with these plans and with these new innovations and seeing how we could tap into other countries' ideas to benefit our own sector, I think we can actually build Nigerian healthcare sector forward. So I would like to hand over to Mr. Shola Odo-Obadimo, the DG of Nigeria. Thank you very much for that.
Thank you, Antonia.
Okay, Shola, before you speak, can I just say something?
Please, sir, go ahead.
Please help me thank Doctors Yakubu and Dr. Ola Brown. I was trying to talk to her. I think I went off the line. I think she had come attended one of our programs before. And I think one of the previous meetings, Dr. Ola, if you're hearing me, I want to thank you very much. Another Yakubu, and I'm very sorry I couldn't get online with some delay, but thank God everything went very well. So I'm very proud of you, and thank you all of you for coming. Mr. Obadimo, please.
Thank you, Mr. President.
Thank you, sir.
So, yes, we've had an interesting session. And let me, first of all, acknowledge and thank the panelists again one by one. Dr. Yakubu Agada, who represented the Executive Secretary of NHIS, is the Acting General Manager and is in charge of standards and quality assurance at NHIS. Dr. Shonibare, the CMD of every care hospital who supported us on this program. Dr. Kukoyi, Mrs. Daly, Temi Daly, the Chief HRO at Sterling Bank, and of course, Dr. Ola Brown. Thank you all. Thank you so much. Now, can we have a word from Mrs. Kehinde Oyeshiku on behalf of Evercare Hospital before we go on to vote of thanks? Mrs. Oyeshiku, are you there? Mrs. Oyeshiku, Kehinde Oyeshiku.
Yes, I'm here. Thank you.
Yeah, you have the floor.
Okay. Thank you, everybody, the panelists, the Nigerian-American Chamber of Commerce. Thank you for the opportunity. My name is Kehinde Oyeshiku. I'm head of business development at Evercare Hospital, Lekki. So just to say a few words about Evercare Hospital, Evercare Lekki is a part of a larger group, the Evercare Group. The Evercare Group is an integrated healthcare platform operating in growth markets across Africa and Asia. In Evercare's portfolio now are 30 hospitals, 16 clinics, and over 50 diagnostic centers. These are in India, Pakistan, Bangladesh, Kenya, and now Nigeria. Evercare is wholly owned by the Evercare Health Fund, which is a $1 billion emerging markets health fund that is managed by the RISE Fund, a part of the TPG Group. So Evercare Hospital Lekki is a 165-bed purpose-built hospital. It's the first of its kind in Nigeria. It's a multi-specialty tertiary care hospital. We offer care across a wide range of medical specialty and surgical services. Our focus at Evercare is to deliver medical excellence and global standards of quality service. What we want to do is to ensure patient satisfaction, exceptional patient satisfaction. So our mission is to provide patient-focused care, with unparalleled patient experience. That is a core area for us. We want people to come into Evercare Hospital and have a different experience from what they're used to. I'll just, provide a little summary of what we have at our facility. So I've mentioned already that it's a 165 bed. That's actually the inpatient beds. We have about 20 plus daycare beds, 22 bed adult ICU, 9 bed neonatal ICU. We have a 5 bed pediatric ICU, 4 operating theaters. We have a cath lab, an endoscopy suite, blood bank, chemotherapy units, dialysis, and our radiology units has, MRI scan, CT scan, the SPECT CT, X-rays, mammography, and all that. Right now, we already have our in-house consultants. We have a team of over 30 in-house consultant specialists that are already in our team, from urology to endocrinology, cardiology. We have gynaes, pediatricians, neurologists, pulmonology, radiology, just to mention a few. And I know Dr. Ayo has mentioned a little bit about telemedicine, but I'll just, quickly talk on that. We've launched a telemedicine platform called the eCare, a robust technology platform that offers access to specialists, from anywhere you are. So you can log onto our platform from our website, evercare.ng, and you can book an appointment to see one of our specialists. Like I mentioned, these are in-house specialists, they're Evercare hospital specialists, and you can have access to them on our technology platform, eCare. It's a robust platform, a secure platform. It enables you to, you can, put in your test results, you can upload your imaging results, you can include a family member to your consultation. It's just really a robust technology platform for telemedicine. So we'll encourage you to go onto our website, evercare.ng, to get more information about this platform, and you can have access immediately. It's up, it's live. You can book appointments through it. And we look forward to to receiving you at our facility when we open. Thank you very much. And if you have any questions, I could answer them. Thank you.
Yeah, thank you, Kende. That's a word from our sponsors. We thank them again. Antonia, thank you so much for helping us to moderate this session. And closing words on behalf of the chamber. As the president mentioned earlier, we have 2 more webinars in November. There is one on access to finance. Access to finance, and we are doing that in conjunction with Standard Chartered Bank. That's on next Tuesday on the 24th. And next week, Friday, there is a credit union initiative that is attempting to put in a banking basket a lot of Nigerians in the US who are presently unbanked and who have no access to credit. So it's an initiative by some Nigerians in the diaspora who are looking for more support from willing stakeholders locally, both in Nigeria and the US. So that will also take place next week, Friday, on the 27th of November. So that's what we have in the immediate future. We thank all our participants again. We thank all our panelists. We thank the Evercare Hospital, Kende, Dr. Shonibare, thank you so much. And we look forward to further collaboration together. Thank you. Have a lovely day.
Thank you.
Thank you very much.
Thank you.
Here, our team, Lekon, Sharon, Femi, Wijo, Precious, Rolake, we say thank you and bye-bye.
Right. Thank you very much.
Thank you.
Voila.